Hello everyone. In this podcast, I am going to present about artificial intelligence in aged care benefits and challenges. Aged care provides support for older people to help them with everyday activities and other needs. There are different types of care that are available in aged care settings, including palliative care, respite care, and end of life care, and so on. So, in this podcast, we will discuss about definition of artificial intelligence, benefits of AI in aged care, various approaches of AI in aged care, challenges of AI in aged care, nurses' role in AI, and the impact of AI in aged care. So, moving on to the meaning of artificial intelligence or the definition of artificial intelligence. Artificial intelligence or AI is the technology that enables computers and machines to simulate human intelligence and problem solving capabilities. So, artificial intelligence refers to the simulation of human intelligence processed by the machines, typically computer systems. So, there are various AI technologies that are available in aged care settings. So, AI technologies that aim to enable the machines to perform the tasks that would normally performed by the human beings. So, there are various approaches of AI that are used in aged care settings. First is symbolic AI. This approach involves programming computers to manipulate symbols and perform logical reasoning tasks. Symbolic AI is mainly based on the rules and representations of knowledge, and it's been often used to expert systems and also rule based decision making. This is very common form of AI that are used in aged care settings. Second one is machine learning. Machine learning is the subset of AI that focuses on developing algorithms that allow the computers to learn from and also making the predictions or decisions based on the data. It mainly encompasses the various techniques such as supervised learning, unsupervised learning, and reinforcement learning. And the third commonest AI that is used by the aged care setting is deep learning. Deep learning is a specialized form of machine learning that uses artificial neural networks with multiple layers to learn complex pattern from the large amounts of data. Particularly, deep learning has achieved remarkable success in areas such as image recognition, natural language processing, and also speech recognition. So this is also commonest AI that's used in the aged care setting. Now, moving on to AI and robotics. Robotics is the common form of human intelligence that is used in artificial intelligence. So, it is mainly helpful in terms of keeping the heart well, in terms of assessment and continuous monitoring of the heart or cardiac system, and also early detection, early diagnosis, decision making, quick decision making particularly, and also treatment, end of life care, research, and training opportunities. So these are all the various usage or various forms of robotics that play a major role in artificial intelligence. Now, moving on to benefits of AI in aged care. So, there are various benefits in aged care, including enhancing the quality of life for the older adults, and also improving the efficiency of caregiving. So, there are some key principles or benefits that are available in aged care setting. First one is personalized care. AI technologies enable personalized care plans tailored to the specific needs and preferences for older adults. By analyzing individual health and also the preferences, AI systems can recommend customized interventions, treatments, and support services to optimize health outcomes, and also it enhances the overall well being of the individual. And second is early detection and prevention. AI-powered health monitoring systems can detect early signs of health deterioration and predict adverse events such as falls and also medication errors among older adults. These two are the commonest events or complications or incidents that happen in the aged care settings. One is falls, and the second one is medication errors in older adults. So, timely interventions based on AI generated insights enable the healthcare providers to prevent further complications, and also it helps to reduce the hospitalizations and improve overall health outcomes. And third is safety and security. AI driven fall detection sensors in the smart homes, particularly in aged care setting or even in the patient's own homes. Smart home devices and video monitoring systems can enhance the safety and security of the older adults by identifying the potential hazards and detecting the emergencies, and this provides the real-time alerts to the caregivers and also healthcare professionals. So these technologies enable older adults to maintain independence, and also it ensures the prompt assistance in case of emergencies. And then next is improved medication management. AI powered medication management systems help older adults to manage their medications, particularly effective by keeping the reminders and also dosage instructions, and it alerts for missed doses, particularly missed doses or medication interactions. So these systems can reduce the risk of medication errors and improve the adherence to the treatment regimes, and also it enhances the safety for older adults as well. And next is enhanced social interaction. AI driven robots, virtual companions, and teleconferences devices provide companionship and social interaction for older adults, and thereby it reduces the feelings of loneliness and also social isolation. So these technologies enable older adults to engage in meaningful conversations, participating in social activities, and also maintaining the connections with loved ones. So thereby it improves overall mental well-being and also emotional well-being. Efficient care delivery. AI technologies, it can streamline the care delivery processes, optimizing the resource allocation, and also improves workflow efficiency in aged care settings. From scheduling appointments and managing the electronic health records to automating the administrative tasks and also coordinating care transitions. So these AI solutions which enable the healthcare providers to focus on delivering high quality care to older adults. And then predictive analysis. Predictive analytics like AI algorithms, they analyze the large amount of data to predict the health risks. It identifies the individuals at risk of developing chronic conditions and also anticipate care needs for older adults. By leveraging these predictive analytics, healthcare professionals can intervene proactively and also optimizes the resource allocation and improve the effectiveness of preventive care strategies, ultimately enhancing the health outcomes and reducing the healthcare cost. And finally, we have aging in place. So AI technologies support aging in place by enabling the older adults to remain in their homes safely and independently for longer periods. Particularly, remote monitoring, telehealth services, and AI-powered home assistance systems provide older adults with access to healthcare services, social support, and assistance with daily tasks, which allows them to age in place comfortably while maintaining their autonomy and quality of life. So, overall, these benefits of AI in aged care are very substantial, and which encompass the improved health outcomes, enhanced safety and security, personalized care delivery, social engagement, and the efficiency in gaining caregiving processes. So, by transforming these power of AI responsibly and ethically, we can still unlock these new responsibilities or new possibilities for enhancing the overall well-being of the individuals in aged care settings. So, moving on to role of AI in healthcare. So, we have role of AI in healthcare, particularly in terms of health monitoring. So, health monitoring means AI-powered devices and sensors. They can continuously monitor the vital signs, activity levels, and also sleep patterns of the older adults. So, these technologies can detect early sign of health deterioration and alert the caregivers of healthcare providers and facilitate timely interventions to prevent other adverse health outcomes. And second is the fault detection and prevention. AI algorithms analyze the data from wearable devices, smart home sensors, and video monitoring systems to detect faults and also predict other false risks among older adults. By identifying potential hazards and also providing real-time alerts, these technologies, they help to prevent falls and also reduce the risk of fall-related injuries as well. Medication management. So this medication management, this assists the older adults in managing their medications effectively, particularly in terms of providing reminders for medication intake, track, and like adhering to the treatment regimens, and also it alerts the caregivers or the healthcare professionals in case of missed doses or medication errors. Cognitive assistance. So this AI, there are applications to support older adults with cognitive impairments such as dementia or Alzheimer's disease by providing cognitive stimulation activities, for example, memory aids and also personalized assistance with the daily tasks. Particularly in terms of virtual assistants and also chatbots, it can engage in conversations and that provides reminders and offer cognitive exercises to improve mental activity. Next is social engagement. So we all know AI driven robots and virtual companions that provide companionship and social interaction for older adults, reducing the feeling of loneliness and isolation. So these technologies can engage in conversation and play games, sharing the short stories and provide emotional support, and it can enhance the overall well-being of the older adults. Personalized care planning. So, as stated earlier, AI algorithms analyze the individual health data and preferences, and thereby it can plan the personalized care for older adults. Particularly, these plans consider factors such as medication, medical history, chronic conditions, medications, mobility limitations, and also social determinants of health, mainly to optimize the care delivery and also improve the health outcomes. And the next one is predictive analytics. AI models analyze large data sets to predict the health risks. It identifies the individuals such as for developing chronic conditions and anticipate care needs for older adults. By leveraging the predictive analytics, healthcare providers can intervene proactively and optimize the resource allocation and improve the effectiveness of preventive care strategies. Next is remote monitoring and telehealth. AI technologies enable the remote monitoring and of the older adults' health status and provide telehealth services to remote consultations, follow-up care, and medication management. These solutions improve the access to healthcare services, reduce the need for in-person visit, and also it enables the older adults to age in place comfortably. So people who live in their own homes, they can access the telehealth services and they can benefit for these services as well. So overall, AI that is revolutionized aged care by enhancing safety and improving the health outcomes, promoting independence, and enhancing the overall quality of life of older adults. So, in this way, it is very essential to address these challenges, particularly privacy, ethics, and usability, to ensure the responsible and effective use of AI technologies in aged care services as well. Moving on to challenges of AI in aged care. So there are, although we say there are benefits to promote improving aged care services, it also have several challenges that needs to be addressed to ensure effective and ethical implementation. So there are some key challenges of AI in aged care. First and foremost thing is privacy and data security. So as we all know, AI systems in aged care, it often rely on the collection and analysis of sensitive health data. So ensuring the privacy and security of this data is very essential to maintain patient trust and comply with the regulations such as HIPAA, especially Health Insurance Portability and Accountability Act in the United States, and also GDPR, General Data Protection Regulation in the European region. Second is the ethical concerns. AI raises ethical questions relating to autonomy, decision making, and the potential for bias in algorithms. So there is a need for ensuring that AI systems respect the dignity, preferences, and rights for the older adults, and that way they do not perpetuate the or exacerbate the existing inequalities in access to care. Human-centric design. It is crucial to design AI systems in aged care with a human-centric approach or person-centered approach, taking into account the unique needs and preferences and limitations for older adults. User-friendly interfaces, clear communications, empathy-driven interactions are very essential for fostering trust and acceptance for AI technologies among older adults and their caregivers. Integration with the existing system. Integrating AI technologies into the existing healthcare infrastructure and workflows can be very challenging, particularly in aged care settings with limited challenges and limited resources and technologies expertise. Seamless interoperability with the electronic health records, communication systems, and other healthcare IT systems is crucial for successful adoption and integration of AI solutions. Next is bias and fairness. AI algorithms can inadvertently perpetuate the biases present in the data used for training, leading into disparities in the healthcare delivery and also outcomes. It is essential to identify and mitigate the bias in the AI systems through robust data governance and also transparency and algorithmic fairness techniques to ensure equitable access care for older adults. Regulatory and legal considerations. The regulatory landscape for AI in healthcare is complex and also evolving, with considerations relating to safety, efficacy, liability, and accountability. Healthcare professionals and developers of AI technologies must navigate the regulatory requirements and ensure compliance with relevant laws and standards to mitigate the legal risks and ensure patient safety. Finally, we have workplace training and adaptation. So the adaptation to AI in aged care requires healthcare professionals to acquire new skills and also adapting to changing the roles and collaborating effectively with other AI systems. So training programs and ongoing education initiatives are needed mainly to prepare the healthcare workers for the integration of these AI technologies into their practice. So these are all the main challenges. Addressing these challenges may require a multidisciplinary approach, including collaboration among healthcare professionals, particularly with technologists, policymakers, ethicists, and other older adults themselves, because we have to address these concerns relating to privacy and also ensuring that ethical and equitable use of AI, designing person-centered approach and integrating AI into existing health systems. So this plays a major role in facing these challenges as well. Now, what are all the impacts of AI in aged care? So, there are several impacts of AI in aged care setting, which are multifaceted, revolutionizing how we can approach this in the health and well-being of the older adults. So, there are some key points that we need to consider when we talk about impact of AI in aged care. First one is improved health monitoring. AI-powered devices and sensors enable continuous monitoring of the vital signs, activity levels, and other health metrics. So, allowing this health monitoring will help us to form a early detection and of the health issues and also timely intervention. So, this proactive approach to monitoring can lead to better health outcomes and also improving the older adults' quality of life, and it reduces the hospitalization for the older adults. Second is enhanced safety and security, such as like the fall detection sensors and smart home devices. It can enhance the safety and security of the older adults by identifying the potential hazards and also by providing alerts in case of emergency. So this technology help the older adults to maintain the independence while they are living in their own homes. And the third one is personalized care and support. So algorithms that analyze the individual's health data and preferences that creates the personalized care plan tailored to the specific needs of the goals of older adults. So particularly relating to medication management, social engagement strategies. So this AI helps to optimize the care delivery to meet the unique requirements of the individual. Next is efficient resource allocation. So as we have AI driven predictive analytics and decision making tools that enables the healthcare professionals to allocate resources more efficiently by identifying high risk patients, predicting health deteriorations, and also recommending appropriate interventions. Augmented caregiving. So AI powered robots and virtual assistants assist the caregivers in performing various tasks such as medication reminders, companionship, and cognitive simulation activities. So these technologies augment the capabilities of caregivers, reduce their workload, and also it enhances the quality of care that is provided to older adults. And next is the cost savings. By improving health outcomes, preventing hospitalization, and reducing the need for institutionalized care, AI in aged care can lead to significant cost savings for healthcare systems and families. So, this cost effectiveness makes AI driven solutions increasingly attractive for addressing the challenges that are associated within an aging population. And finally, we have empowering aging in place. This is very, very important because many of the older adults, they prefer to stay in their own homes. So AI technologies enable older adults to aging in place comfortably and safely by promoting remote monitoring, telehealth services, and virtual support networks. So these solutions empower older adults to maintain independence and autonomy while they receive the care and support they need to thrive in their own homes. So these are all the impact of AI in aged care. It is a transformative and offering innovative solutions to address the complex needs of older adults that enhance their quality of life. However, it is essential to ensure that these technologies are implemented ethically with a focus on privacy, dignity, and human-centric approach. Next, moving on to role of nurse in AI in aged care. So nurses play a crucial role in integration and implementation of AI technologies in aged care setting. So there are the key roles that RN needs to play relating to AI in aged care setting. First is assessment and planning. Nurses are responsible for assessing the healthcare needs and preferences for older adults and developing the personalized care plans. They play a vital role in identifying the opportunities for integrating AI technologies to improve patient outcomes, enhance safety, and optimize care delivery. Collaboration and communication. Nurses collaborate with interdisciplinary teams, including healthcare professionals, technologists, caregivers, and also older adults themselves, mainly to effectively integrate AI technologies into aged care practices. So they facilitate communication, coordinate the care, and ensure that AI solutions align with the needs and goals of the older adults. Education and training. Nurses educate older adults, caregivers, and other healthcare professionals about the benefits, risks, and proper use of AI technologies in aged care. So they provide training and support to ensure that individuals understand how to interact with AI powered devices, interpret AI generated data, and also make informed decisions about their care. Next is monitoring and evaluation. So nurses monitor the implementation and performance of AI technologies in aged care settings, mainly to assess their effectiveness, usability, and impact on the patient outcomes. So they collect feedback from older adults and their caregivers, identify the areas for improvement, and advocate for adjustments to enhance the usability and acceptance of AI solutions. And then next is ethical and legal considerations. Nurses navigate ethical and legal considerations relating to the use of AI in aged care, such as privacy, confidentiality, informed consent, and algorithmic bias. So they ensure that AI technologies are deployed ethically and respect the autonomy and dignity of older adults, and also they comply with the regulatory requirements and professional standards. Next is the quality improvement. Nurses participate in quality improvement initiatives to optimize the integration of AI technologies into aged care practices. They contribute to the development of best practices, guidelines, and protocols for using AI powered systems effectively, ensuring patient safety and promoting quality of care. Next is patient advocacy. As we all know, nurses advocate for the needs and preferences of older adults and their caregivers in the development and deployment of AI technologies in aged care. They champion the person-centered approaches, advocate for equitable access to AI-powered solutions, and also promote the empowerment of older adults in decision making, and particularly relating to advanced care planning in their care. And then finally, we have adaptation and innovation. Nurses embrace innovation and adapt to changes in healthcare delivery models driven by AI technologies. So they stay abreast of the advancements in AI, participate in training programs, and contribute to the research and innovation efforts aimed at leveraging AI to enhance the aged care practices and also improve the outcomes for older adults. So overall, nurses play a major role in harnessing the potential of AI technologies into enhance aged care delivery, promote patient-centered approach, and improve the quality of life for older adults. So their expertise, compassion, and advocacy are essential in ensuring that AI solutions are effectively integrated into aged care practices while prioritizing the needs and well-being of older adults. So now, what are all the applications of AI in general healthcare systems? So there are various ways that we can integrate AI into healthcare settings. First is rare disease diagnosis and treatment, virtual nursing assistant, fraud detection, cybersecurity, gene editing, and AI robot assisted surgery, personalized healthcare plans, cancer research, dosage error reduction, medical diagnosis, drug development in terms of research. Okay, and apart from this, training also. So these are all the ways that we can apply AI into our healthcare system. So now, what are all the future of AI, particularly in aged care setting? The future of AI holds immense potential for transforming various ways of aspects of society, economy, and technology. So there are some key points that we have to keep in mind that are helpful in development to shape the future of AI. So first and foremost thing is advancement in deep learning. Deep learning is a subset of AI, has shown remarkable progress in recent years, particularly in areas such as image recognition, natural language processing, and speech recognition. So continued advancement in deep learning algorithms, architects, and also training techniques are expected to drive further breakout AI capabilities. And second is the AI powered automation. AI technologies will increasingly automate routine and repetitive tasks such as industries, leading to improved efficiency, productivity, and also cost saving. Automation will revolutionize sectors such as manufacturing, transportation, healthcare, finance, customer service, and enabling the humans to focus more creative and complex tasks. Third one is explainable AI. As AI systems become more prevalent in critical decision making processes, there is a growing need for transparency and explainability. Explainable AI techniques are aimed to make AI algorithms more interpretable and understandable to humans, enhancing trust, accountability, and regulatory compliance. Next is AI at the edge. Edge AI involves deploying AI algorithms and models directly on the devices at the network edge, such as smartphones, LOT devices, and edge servers, enabling real time inference and decision making without relying on the cloud infrastructure. Edge AI brings advantages such as low latency, privacy preservation, and reduced bandwidth requirements, making it well suited for applications in autonomous vehicles, smart cities, healthcare monitoring, and industrial lot. And next we have is the AI in healthcare. AI technologies hold significant promise for revolutionizing healthcare delivery, from personalized medicine and medical imaging diagnosis to drug delivery and predictive analytics for patient outcomes. So AI powered healthcare solutions will enable early disease detection, precision treatment planning, and improved patient care management. Next, we have ethical AI governance. As AI becomes more pervasive in society, there is a growing need for ethical AI governance framework to ensure that AI systems are developed, deployed, and used responsibly. This includes addressing concerns relating to fairness, transparency, accountability, privacy, and bias mitigation in AI algorithms and applications. Next is AI in social good. AI has the potential to address some of the world's most pressing challenges, including poverty, inequality, healthcare disparities, climate change, and humanitarian crisis. AI for Social Good initiative focuses on leveraging AI technologies to create positive social impact, such as disaster response, wildlife conservation, education accessibility, and sustainable development. Finally, we have human AI collaboration. The future of AI is not about replacing human, but augmenting the human intelligence and capabilities. So, human AI collaboration involves integrating AI technologies into human workflows, decision making processes, creativity to enhance productivity, innovation, and problem solving across diverse domains. So, overall, the future of AI holds tremendous promise for driving innovation, economic growth, and social progresses, but it also raises important questions and challenges that need to be addressed collaboratively by the researchers, policymakers, industry stakeholders, and society as a whole. So that's about future of AI. These are all my references. That completes today's presentation. Thank you all so much for listening. I will see you in another topic in another time. Thank you all so much.